So AMO Pharma is it's a youngish company. We're 5 years old. Half of our employees are here in the UK, where I am, and half of ours are where you are in the US, on the eastern seaboard and also the west coast. The company was founded, as I said, about 5 years ago. The original founders and founding management all have a personal interest in what we call developmental disorders, and we'll come back to what that means in a moment. And we are focused within the developmental disorders exclusively on rare or ultra rare orphan drug conditions. And these are genetically determined disorders that make themselves apparent early in childhood, persist throughout life, which have a core component to affect the function of the central nervous system, so learning and processing of information by the brain in order to enable cognition and social and communication function. Those conditions may be associated with other central nervous system features, epilepsy or sleep problems. And sadly, for most of these very rare genetically determined disorders that we're interested in, many have a component outside the brain as well, so that the affected individual can have serious medical conditions. We're interested exclusively on developing new treatment options for individuals affected by these disorders by addressing the underlying biology of the disorder. We're not really so focused on a symptomatic treatment of an associated comorbidity or symptom. We want to get to the heart of what's going on with the biology that's creating difficulties for these individuals. We're now a clinical stage company. We have a pipeline of 3 assets. Our most advanced asset, I would have hoped we would have been announcing the initiation of a phase 3 trial right about now, but coronavirus has obviously had an impact on our ability to do that. But that is a trial in something called congenital myotonic dystrophy. We have a fully funded program there, the finance to take that through to an NDA submission in the US or the equivalent elsewhere. Beyond that, we are rapidly advancing a program through preclinical efficacy and now into initial clinical studies, a compound that addresses increased activity of the RAS-ERK pathway, which has potential to treat a number of developmental disorders. And then we have a third program, which is clinic ready, directed at conditions like Rett syndrome.